Here's something most people don't realize. After age 60, your body absorbs nutrients differently. Your stomach produces less acid. Your kidneys filter things out faster. Medications, sometimes 3, 4, 5 at a time, steal vitamins right out of your bloodstream before your cells ever get to use them. A study from Tufts University found that nearly 1 in 3 adults over 60 has at least one significant nutrient deficiency, 1 in 3. And the tricky part? The symptoms often masquerade as ordinary aging. You assume the tiredness, the aches, the foggy thinking, that's just what happens when you get older, but it doesn't have to be. So let's walk through these 23 signs together, grouped by the nutrient your body is likely missing. Grab a pen if you'd like. You might recognize yourself in more than one of these. Sign 1. Extreme fatigue. That sleep doesn't fix you slept 7-8 hours. You still wake up feeling like you ran a marathon in your dreams. This bone-deep exhaustion that no amount of rest touches. It's one of the earliest signs of iron deficiency. Iron carries oxygen through your blood to every organ, every muscle. When levels drop, your cells essentially suffocate slowly. Women who went through menopause late, anyone on blood thinners, people with digestive conditions, they're particularly vulnerable. A simple blood panel measuring ferritin levels can confirm it. Sign 2. Pale or yellowish skin. Look at the inside of your lower eyelids. Pull one down gently. If the tissue looks pale, almost white instead of a healthy pink-red, that's your body showing you it doesn't have enough red blood cells. Paleness around the nail beds and gums tells a similar story. This connects to both iron and vitamin B12 deficiency. When B12 runs critically low, your body produces red blood cells that are too large and fragile, breaking apart before they can do their job. The skin takes on a faint yellowish cast from the breakdown products. Sign 3. Tingling or numbness in hands and feet. Many seniors report this to their doctors and hear peripheral neuropathy without much explanation. But that tingling, pins and needles in your fingers, numbness creeping into your toes, frequently traces back to vitamin B12 deficiency. B12 maintains the protective sheath around your nerves called myelin. Without adequate B12, that sheath deteriorates. The nerve signals misfire. You feel phantom sensations or lose feeling entirely. Adults over 60 absorb B12 from food poorly because stomach acid production declines. Even if you eat plenty of meat and eggs, your body might not extract what it needs. Sign 4. Muscle cramps and spasms. 3 in the morning. Your calf seizes like someone wrapped a vice around it. You're gasping, grabbing your leg, trying to flex your foot to release it. Sound familiar? Magnesium deficiency is one of the most common culprits. Magnesium regulates muscle contraction and relaxation. When levels fall, often from diuretics or simply not eating enough leafy greens and nuts, your muscles lose the ability to relax properly. They lock. They spasm. Potassium and calcium deficiencies compound this problem. Sign 5. Bone pain and frequent fractures. If you've fractured a bone from a minor fall, or you feel a deep ache in your shins, pelvis, or lower back that seems to come from inside the bone itself, your body may be critically low in vitamin D. Vitamin D allows your intestines to absorb calcium. Without it, calcium passes right through you. Your bones weaken month after month. After 60, your skin produces roughly 75% less vitamin D from sunlight than it did when you were 20. 75% less. If you spend most of your time indoors, you're almost certainly deficient. Sign 6. Wounds that heal slowly. You nicked your hand in the kitchen 2 weeks ago. It's still not closed. Slow wound healing, particularly cuts, scrapes, and surgical incisions that linger, often signals vitamin C deficiency. Vitamin C is essential for collagen production, the protein that literally stitches your skin back together. It also supports immune cells that prevent wound infection. Many seniors eat fewer fresh fruits and vegetables than they realize, especially during winter months when produce costs rise. Sign 7. Easy bruising bruises appearing on your arms, legs, or torso without any memory of bumping into something. Your capillaries, the tiniest blood vessels beneath your skin, need both vitamin C and vitamin K to maintain their integrity. When either runs low, those capillaries rupture from the slightest pressure, a firm handshake, leaning against a counter, carrying groceries. Vitamin K deficiency specifically impairs your blood's ability to clot, making even micro injuries visible as purple-blue patches. Sign 8. Hair thinning or loss. Your hairbrush collects more hair than it used to. Your part seems wider. The volume you once had feels like a memory. While some hair changes accompany aging naturally, accelerated thinning often connects to deficiencies in iron, zinc, biotin, or vitamin D. Your hair follicles are among the fastest dividing cells in your body. They demand a constant supply of nutrients. When supplies run short, your body triages. It sends resources to vital organs first. Hair is considered expendable. It thins. It falls. Sign 9. Brittle, ridged, or spoon-shaped nails. Look at your fingernails. Do you see vertical ridges running from base to tip? Do they crack or peel easily? Are they concave, curving upward at the edges like a tiny spoon? Spoon-shaped nails, called koilonychia, are a classic sign of iron deficiency. Brittle nails that split horizontally often indicate low biotin or calcium. Your nails grow slowly enough that deficiencies show their effects over weeks and months, like a slow-motion record of what's happening inside you. Sign 10. Mouth ulcers and cracked corners of the lips. Those painful sores inside your cheeks, or the raw cracks at the corners of your mouth that sting when you eat. They're called angular cheilitis, and they wave a red flag for B vitamin deficiencies. B2, B3, B6, and B12 all maintain the delicate mucous membranes inside your mouth. A shortage of iron or zinc compounds the problem. If you find yourself developing these sores repeatedly, your body is speaking clearly. Sign 11. A swollen, inflamed tongue. A healthy tongue is pink with small visible bumps called papillae. When nutrient levels plummet, particularly B12, folate, or iron, the tongue swells, turns smooth and glossy, and changes color to a deep magenta or red. This condition, glossitis, can make eating uncomfortable and alter your sense of taste, which creates a vicious cycle. Food tastes wrong, so you eat less, which deepens the deficiency. Sign 12. Restless legs at night. That unbearable urge to move your legs when you're lying still, the crawling sensation deep inside the muscle. Restless leg syndrome affects millions of older adults, and research has linked it strongly to low iron stores in the brain, even when blood iron levels appear borderline normal. Magnesium and folate deficiencies also contribute. It robs you of sleep, which cascades into every other aspect of health. Pause for a moment. How many of these have you recognized in yourself or someone you love? If you're over 60, or if you're caring for an elderly parent, spouse, or friend, this information could genuinely change the quality of their daily life. Sometimes the difference between feeling 80 and feeling 60 is a single missing nutrient. Keep watching. We're halfway through, and some of the most overlooked signs are still ahead. If this is resonating with you, tap that subscribe button. We release videos like this every week, focused entirely on helping you live better after 60. Sign 13. Mood changes, irritability, or depression. Feeling low, anxious, or inexplicably irritable, and it doesn't seem connected to anything happening in your life. Vitamin D deficiency has been linked in multiple large-scale studies to increased rates of depression in older adults. B12, folate, and omega-3 fatty acids also play critical roles in producing serotonin and dopamine, the brain chemicals that regulate mood. Before assuming sadness is situational, it's worth checking whether your brain has the raw materials it needs to manufacture contentment. Sign 14. Brain fog and memory difficulties. You walk into a room and forget why. Names slip away mid-sentence. Concentrating on a book feels impossible. While everyone experiences occasional forgetfulness, persistent cognitive cloudiness in seniors correlates with deficiencies in B12, vitamin D, omega-3s, and iron. B12 deficiency severe enough to cause neurological symptoms can actually mimic early dementia, And unlike true dementia, it's reversible once levels are restored. That distinction matters enormously. Sign 15. Heart palpitations or irregular heartbeat. Your heart flutters, skips, races for no apparent reason. Magnesium and potassium are electrolytes that regulate your heart's electrical rhythm. When they drop too low, from medications, inadequate diet, or excessive sweating, the heart's rhythm destabilizes. Iron and B12 deficiency also force your heart to work harder to circulate oxygen-depleted blood, creating the sensation of pounding or racing. Sign 16. Night blindness or dry eyes. Driving at night has become frightening. Oncoming headlights blind you longer than they used to. Your eyes feel gritty and dry, regardless of drops. Vitamin A deficiency, while less common in the developed world, still occurs in seniors who eat very limited diets or have fat absorption problems. Vitamin A maintains the rhodopsin in your retinas, the pigment responsible for seeing in low light. Omega-3 deficiency contributes to chronic dry eye by reducing the oily layer of your tear film. Sign 17. Frequent infections or slow recovery from illness. Every cold lasts 3 weeks. Every minor infection requires antibiotics. Your immune system feels perpetually overwhelmed. Vitamin D, vitamin C, and zinc form the backbone of immune defense. Zinc deficiency in particular impairs your white blood cells' ability to attack pathogens. Studies show that seniors with adequate zinc levels recover from respiratory infections significantly faster. If you catch everything that circulates through your community, your nutrient stores deserve scrutiny. Sign 18. Bleeding gums. You brush your teeth and spit pink. Your gums bleed when you floss or even when you eat something firm like an apple. While gum disease plays a role, chronically bleeding gums that don't respond to improved dental hygiene often point to vitamin C deficiency. Severe cases constitute scurvy, which still exists even today, particularly among older adults living alone who eat primarily processed, shelf-stable foods with little fresh produce. Sign 19. Dry, scaly. Skin or persistent rashes. Your skin flakes no matter how much lotion you apply. Rough, bumpy patches appear on the backs of your arms or thighs, a condition called keratosis pilaris. Dry, cracked skin that splits painfully at the heels or fingertips. These patterns suggest deficiencies in essential fatty acids, vitamin A, vitamin D, or zinc. Your skin replaces itself entirely every 28 days. Each new layer requires adequate building materials. Without them, the replacement skin arrives compromised, thin, dry, inflamed. Sign 20. Muscle weakness, especially in the legs. Standing from a chair has become a project. Climbing stairs exhausts your thighs within a few steps. Generalized muscle weakness, distinct from joint pain, often traces to vitamin D deficiency. Vitamin D receptors exist throughout muscle tissue. When levels fall below adequate, muscles lose both strength and coordination, dramatically increasing fall risk. This is one reason vitamin D supplementation reduces fracture rates in seniors, not only by strengthening bone, but by preventing the fall itself. Sign 21. Loss of appetite or unexplained weight loss. Food simply doesn't appeal to you the way it once did. You eat half portions without thinking about it. The weight drops quietly, 5 pounds, then 10. Zinc deficiency dulls taste and smell, making food seem bland and unappetizing. B1 deficiency, thiamine, suppresses appetite through neurological pathways. The resulting weight loss then accelerates every other deficiency because you're consuming even fewer nutrients, a dangerous spiral that demands attention. Sign 22. Joint pain and stiffness not explained by arthritis. Your joints ache and creak, but your doctor says your arthritis imaging looks stable, no worse than last year. Yet the pain has worsened. Vitamin D deficiency causes joint pain that mimics or amplifies arthritis. Omega-3 deficiency increases systemic inflammation, making every joint feel stiffer and more tender. Vitamin C deficiency weakens the connective tissue surrounding joints. Sometimes what feels like worsening arthritis is actually a nutritional gap layered on top of an existing condition. Sign 23. a general sense that something is off. This final sign is the hardest to pin down, but perhaps the most important. A pervasive feeling that your body isn't functioning the way it should. Not one dramatic symptom, just a collection of small, nagging wrongnesses. Slightly more tired, slightly more achy, slightly more forgetful, slightly more fragile. When multiple mild deficiencies accumulate, they create a composite experience of premature decline that many people accept as inevitable aging. It isn't inevitable, it's fixable. So, what do you do with all of this information? Here's where you take action. First, request a comprehensive blood panel from your doctor. Ask specifically for vitamin D, B12, folate, iron, including ferritin, magnesium, and zinc. Many standard panels don't include all of these unless you ask. Write them down. Bring the list to your appointment. Second, examine your diet honestly. Are you eating dark leafy greens several times a week? Fatty fish like salmon or sardines, eggs, nuts and seeds, citrus fruits or bell peppers, fortified cereals? If your diet has narrowed over the years, fewer ingredients, simpler meals, your nutrient intake has narrowed with it. Third, discuss supplementation with your doctor. Vitamin D3 at 1,000 to 2,000 international units daily is appropriate for most seniors. Sublingual B12 bypasses the absorption problems caused by low stomach acid. Magnesium glycinate absorbs well and won't upset your stomach the way cheaper forms can. But dosages should be personalized, especially if you take medications that interact. Fourth, review your medications. Proton pump inhibitors for acid reflux deplete B12 and magnesium. Metformin depletes B12. Diuretics flush potassium and magnesium. Statins may reduce CoQ10. You don't stop medications without medical guidance, but you do compensate for what they take. Fifth, prioritize sunlight. Even 15 minutes of morning sun on your forearms and face without sunscreen for that brief window stimulates meaningful vitamin D production. If mobility limits your outdoor time, a vitamin D supplement becomes essential rather than optional. Let me bring this together for you. Your body communicates constantly. Fatigue, tingling, cramps, fog, pain, bruises, slow healing, none of these are sentences you must accept. They're questions your body is asking, and the answer, remarkably often, comes in the form of a nutrient it's been missing. 23 signs, 23 opportunities to listen, respond, and feel measurably better, sometimes within weeks of correcting the deficiency. You have lived 60, 70, 80 years in this body. It has carried you through decades of experience, work, love, and challenge. It deserves to be fed properly, not with expensive miracle supplements or complicated regimens, just with the basic vitamins and minerals it has always needed and isn't getting enough of anymore. Don't wait for these signs to worsen. Don't dismiss them as age. Bring this list to your next doctor's appointment. Have the conversation. Get the blood work. Make the changes. If this video helped you recognize something you've been ignoring, share it with someone you love. Send it to your spouse, your sibling, your adult children. Sometimes the people closest to us notice the signs before we do, but only if they know what to look for. Subscribe to this channel if you haven't already. We publish new senior health content every week, practical, clear, and designed specifically for life after 60. Drop a comment below telling me which sign surprised you the most or which one you recognized immediately. I read every single comment, and your experience might help someone else watching today. Take care of yourself. Your body is listening, and now, so are you.